Good morning, everyone. My name is Tanya Batra, and I am a RCI registered special educator. You can also call me as Learning Support Educator. Every child is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it is stupid. This is given by Albert Einstein. Today, in this particular session, we are going to discuss on the topic hyperactivity and how to support hyperactive child in academics. So let's move further. In this particular session, we will be discussing about hyperactivity, which is the part of ADHD, attention deficit hyperactivity disorder. But this particular session and this particular presentation will be focusing only on hyperactivity. I will be making a detailed video on ADHD also. So let's move further and first of all discuss that what hyperactivity is. Hyperactivity means having increased movement, impulsive action, shorter attention span, and being easily distracted. So children having hyperactivity, these are some of the characteristics which you will observe, and this is usually, you can say, uh, it shows that yes, that the child is having hyperactivity, that is increased movements, lots of rapid movements, impulsive action, repetitive movements, a shorter attention span, and getting distracted, getting focused, not able to focus, not able to pay attention on a particular task. So all of these constitute hyperactivity. Hyperactivity is not easily defined. It often depends upon the observer. Very important. Behavior that seems excessive to one person may not seem excessive to another. Like for an example, for a child A, his behavior might be an hyperactive behavior for somebody in the class, but might not be an hyperactive behavior for another teacher in the class. Okay, so it's not easy to define hyperactivity, but for some of the people, some behaviors are termed as hyperactivity, though they might not be. Okay, but certain children, when compared to others, are clearly far more active. This is a very important term to know that when we are observing that some children are far more active than other children, and that particular overactivity is interfering it in their academics, is interfering in their daily life, is affecting their study skills, is affecting their reading, writing, maths, is affecting their sitting span in the class, is affecting their other daily activities, then at that situation we can say that their hyperactivity is need to be given an intervention. Okay, because that particular hyperactivity is not helping the child, it is increasing the difficulty. So it is very important to provide support as soon as possible. Hyperactivity means a person may seem to move about constantly, including in situations when it is not appropriate. So you can also say that when a person or a child is showing any kind of inappropriate constant movements, okay, inappropriate behavior, or you can say inappropriate overactivity, or having a motor driven behavior in him or her, then we can say that yes, the person is having or the child is having hyperactivity. Okay, including in situations when it is not appropriate, like excessively fidgeting, tapping, talking. In adults, hyperactivity may mean extreme restlessness or talking too much. So these two are the characteristics of hyperactivity in adults. When they're constantly talking too much without listening to somebody, without understanding their needs, without understanding what the other person is trying to say, or extreme restlessness. Okay. Now, these are some of the characteristics of a hyperactive child, which is given according to, which I mentioned according to DSM 5. Number one, often fidgets with or taps hands or feet or squirms in a seat. So excessive movement when the child is sitting, fidgeting, tapping hands or feet often leaves their seat in situation when remaining seated is expected. Now, if we discuss about some of the classroom scenarios in which the child is expected to be seated. For an example, for a reading task, for a writing task, for performing calculations, for understanding the passage, understanding the lesson, for memorizing the lesson. So these are some of the situations in which the child is required to be seated. In that particular situation, the child often leaves the seat. The child will get up and will leave, or will start showing another excessive movements. Okay. Example, leaving his or her place in the classroom, in the office, or other workplace, or in any other situation that require to be seated in one place. Okay. Often runs about or climbs in situation where it is inappropriate. Where the child is not required to climb, there the child will climb, there the child will show hyperactivity. जहाँ पे भागने की जरूरत नहीं है वहां पे बच्चा भागेगा, वहां पे ऐसे बिहेवियर शो करेगा. So that again can be constituted or can be understood as hyperactivity. In adolescents or adults may be limited to feeling restless. When I'm talking about children or adolescents, adults, which is constituted as, or you can say the hyperactive adolescents or hyperactive adults, in that case, they are restless. They might be lethargic, they might be lazy, not ready to some particular task. So these are the some characteristics which are observed in adolescents or adults. Okay. Now here in the picture, it's mentioned destructive overactivity is called hyperactivity. Any overactivity, any excess energy, any excess kind of activity which is disrupting the daily life of the child, which is affecting his academics, his academic performance, his other communication skills, his social skills, or any other parts of his life, we can say that yes, the child is having hyperactivity. Okay. Next, just a minute. Okay, next. Correct. Further characteristics of an hyperactive child, according to DSM-5, often unable to play or take part in leisure activities quietly. Okay, so you will observe that children with hyperactivity, they will not be able to participate in in some kind of leisure activities very calmly, very smoothly, or very quietly. Like for an example, it's a reading activity going on in the library, or any kind of drawing activity is going on, any kind of play activity is going on. The child would like to be very loud, would like to show his energy, would like to move between the rows, between the chairs, and would like to show his excess of activity in that particular area, okay, is often on the go, acting as if the child is driven by a motor. So, excess of energy you will observe in children having a hyperactivity. Is he unable to be or uncomfortable being still for extended time, like in restaurants, in meetings, may be experienced by others as being restless or difficult to keep up with. Okay, so where the child, for an example, if some task is exceeded with some extra time, there the child might show uncomfortability. The child would not feel comfortable, the child would show restless behavior, the child would get up from the seat, will try to avoid the situation, would try to run away from that particular place because that time is being exceeded. Like if we inform that we are here for a particular time, we are here at this place for 10 minutes. But if the time gets exceeded, the child is not able to understand that situation and would like to run away from that. Often talking excessively, speaking a lot, understanding less, listening less, and would be speaking, would be talking excessively, would be keeping his points impulsively in the class, in the at the home, at the other situations. Okay. Fidgeting, squirming frequently, running, climbing inappropriately, trouble with the quiet activities, the activities which requires patience, which requires calm behavior, which requires the person to sit at a place and to focus on the task. Such activities are difficult for a child having hyperactivity, like especially writing task, especially during exams, when the child has to sit at a particular place, concentrate on the answers, understand the answers, and recall whatever he has learned and write it down on the paper. This particular task is quite tough for children having hyperactivity. Has trouble waiting for their turn. Why do I have to wait? Why do I have to stand in a long queue and I have to wait for my turn? Why I can't stand in the front? So such kind of behaviors you will also observe. Now, the challenges of children facing hyperactivity has been divided into these sections, that is academic, social, emotional, behavioral, and long term. Okay, so first, if we talk about academic, now when I'm talking about a child having hyperactivity, it is very important, first of all, to understand that the child is showing his or her hyperactivity is not his or her fault. Okay, the child is showing such kind of behavior because of certain reasons, because of, you can say, psychological processing disorders in the brain. Some wiring connections are not working properly in the mind, in the brain of the child, because of which that hyperactivity is being observed, or the child himself is facing so many difficulties due to that hyperactive behavior. So, first, understanding this thing is very important for a teacher, for a parent. That all of these behaviors is not an excuse for the child to not to study or to not to pay attention in the class or to just, I don't want to do work. It's just not an excuse that the child is trying to show such kind of behavior and he is not overacting, or we can't say that the child is, giving an excuse for this, that he just want to avoid the task, that's why he's just giving an excuse, like we say कि बहाना कर रहा है बच्चा, जानबूझ के ऐसा behavior show कर रहा है. No, it's not like that. It's not his fault at all. So this thing is very important to understand. Even an hyperactive child internally is facing lots of difficulty, lots of challenges. As a special educator, as a parent, as a general classroom teacher, it is very important to understand this point. So instead of, blaming the child or putting some taglines on that particular child, it's very necessary that we all meet together, we all collaborate with each other to help the child, to support the child in all of his areas. Okay. Now, these are the areas in which all the rehabilitation professionals can work upon, because we know that an hyperactive child is facing these and these difficulties and he is not able to communicate this with anyone. So, this might be so much of burden for the child itself, like academic difficulties, or you can say the academic challenges faced by the child. Difficulty focusing. The child wants to focus in that task, but he is not able to. So, difficulty focusing, impulsivity, repetitively giving the answer, speaking blurts out in the class when the teacher is teaching. The child wants to get up and wants to interrupt the class. He is not doing it because he wants to. He his brain activity is happening in such a way that it forces him to behave like this. Okay, disorganized behavior, difficulty in following instructions. Then social challenges faced by the hyperactive child is impulsivity in social interaction, difficulty in reading social cues. If, for an example, social cues, like if the mother is pointing out something to the child, or if the teacher is giving some, uh, you know, giving some commands, giving some help to the child with the help of some facial expressions, with the help of some gestures, but the child will not be able to catch it. The child will not be able to understand. High activity levels in a social gathering, the child might be sitting, interrupting the conversations, coming between the lines, or just engaging in somebody else conversation, in somebody else doing any activity, so not able to control his or her activity, he just jump into the task. Then emotional challenges, frustration and low self-esteem, mood swings, anxiety, stress. These are some of the emotional challenges faced by the child. Internally, the child might be having very low self-esteem, would be having lack of confidence, would not be taking an initiative to participate on his own, or on his own, wish, because he also might be thinking that yes, again and again I'm being pointed out, again and again I'm being scolded by some of the other members. Then behavioral challenges like restlessness, risky behavior, resist following rules and instructions. Long-term challenges like academic underachievement. In all the grades, the child might be not able to score well. Social isolation, might not be able to make friends, might not be able to continue with some friendship, might not be able to initiate a conversation with a friend, might not be able to understand how to, help my friend, how to support my friend. So all of this may lead to that the child is always alone, not having any friend circle, not having any friends or any person to talk. Mental health issues again might go into certain of the lack of self-esteem, poor self-image about himself, low confidence, not taking initiative, not participating, not talking to anyone, just engaging in some games, engaging in risky behaviors. All of this can be included, all of this. So basically, this all are the challenges that are faced by an hyperactive child. Now, next. Okay, brain functions of a hyperactive child. In my previous slide, I mentioned this, that whatever behaviors that a hyperactive child is showing to us is not because he wants to, is not according to his will. Okay, that I will behave like this. मैं जानबूझ के ऐसा behave करूंगा. मैं जानबूझ के ऐसे excuses दूंगा. Not at all. It is because how his brain is functioning, and such kind of behaviors are shown by an hyperactive child because of his brain activity. Okay, so I will be discussing in a very basic format about the brain functions of a hyperactive child. Research shows that some parts of the brain tend to be a little smaller and or take longer to mature in kids with ADHD. This doesn't mean kids with ADHD aren't smart. It means parts of their brain take longer to develop. Okay. So basically, if there is a child in fourth grade, you can say a general child, okay, who is not having ADHD, who is not having hyperactivity, that growth of his brain, the growth of that particular child will be average. And but if I'm talking about the another child who is hyperactive in class fourth itself, the brain of that particular child would be not that much mature as compared to the other general category child in that particular grade. So the functions of the brain of a general category child will be average, but not average in the case of hyperactive child. Okay, so because the brain of an hyperactive child takes time to get mature, takes time to develop according to his or her age. Okay, different parts of the brain are connected by networks of neurons. Now, in our brain, there are certain lobes which have different functions. Like if I'm talking about my frontal lobe, the frontal lobe has certain functions performing the executive task, thinking, memorizing, recalling, reading, understanding the instructions. Okay. Now, in the entire brain, there are neurons which passes the information from one lobe to another. Okay. Some neural networks take longer to develop. Now, like if one information has to be sent from one lobe to another lobe of my brain, which is connected by a neuron, but in the person with ADHD or hyperactive child, in that case, the neural network is weak. Okay, that neural network is not able to transfer the information as quick as it is happening in a general category person or a general category child. Okay, so some neural networks take longer to develop, take longer time to transfer the information from one lobe to another lobe. Okay, and maybe less efficient in kids with ADHD. There might be slow activity, there might be sometimes the electrical charges are not functioning at the power, because of which the information processed by the child with ADHD is slow, is weak, and the child takes time to respond. Okay. Now, this is some, you can say, EEG brain research in ADHD. We call it as scan of the brain. Now you can see how the normal brain functions and how the ADHD brain is functioning. Yes, on the figure. This is one of the typical brain map patterns seen in a child with ADHD. It shows an underactive, the red color, frontal lobe behind the forehead. So it's underactive, but in the case of normal brain, EEG, it's active. Now, these are some of the areas that are mentioned, which is associated, or which you can say these are the areas of the brain which are affected when we are talking about ADHD or hyperactivity. Prefrontal cortex, which controls, which functions attention, decision making, impulse, problem solving. So these areas are affected, and you can say that's the reason if it is affected, these are the characteristics of children with ADHD, right? Basal ganglia, it's at the center of our brain, which is involved in controlling movements and coordination. And again, this is also affected. Cerebellum, which is associated with motor control. The cerebellum plays a very important role in cognitive function. So this is also affected. There are differences in the size and activity of the cerebellum have been observed in children with ADHD. So that's the reason these are all the challenges faced by a child having hyperactivity. How to support an hyperactive child in teaching. As the name of the topic also says, supporting an hyperactive child in academics. So we will be discussing how to support an hyperactive child in teaching and how to support an hyperactive child in learning. Okay. So some of the important points, very important. Giving space for extra energy. If you're planning to teach a very important concept in the class, which requires the child to be seated, before that, make sure you are giving space to the child to take out his extra energy by doing any kind of physical activity. Running करा दी, कोई exercise करा दी, कोई movement activity करा दी. आप जब एक्टिविटी के उस टॉपिक को पढ़ाने के इनिशियल फेज पर ही कोई फिजिकल एक्सरसाइज बच्चे से कराएंगे, द एक्स्ट्रा एनर्जी विल dissolve, the extra energy will lower down, and then the child might feel that yes, now I need to be seated, now I need to rest. So then the child might sit and would be able to pay attention to what you are saying. सो बच्चे की एक्स्ट्रा एनर्जी को पहले आपको बर्न आउट कराना पड़ेगा, so that the child gets ready for the activity in which he requires to pay his attention. Limit distractions. We need to note down कौन सी ऐसी चीजें उसके environment में बच्चे को distract करती है. It might be any toy, it might be any chair, it might be the window, it might be the doorbell, it might be any other person in the room, it might be any game, it can be any technology. So, first, we need to remove all those distractions. Usually, in my special education sessions, I make sure that there is a small room in which the child is seated with me for the academic part, and in the room, there is nothing except for one table, one chair, and the tools that I need to use. And those tools are only under my control, my reach. It's not under the reach of the child. The child cannot reach to those resources which I want to use for the present session. So try this particular remedy, or you can say this particular strategy, that if you're planning to teach the child in your session, make sure there is no distraction. जितना छोटा आप रूम लेंगे या comfortable रूम लेंगे, it should not be too large. The room should not be too big, not to be small. It should be age appropriate. It should be according to the convenience in which the physical activity is also done and the child also remains seated. Okay. Providing frequent feedback. It should be very clear. जो भी बच्चा task कर रहा है, बच्चे को feedback दीजिए. Like for an example, if the child is not behaving appropriately, say it, inform it to the child. Like for an example, I'm using a hypothetical name. Like if I say, Rian, I'm not liking your behavior of jumping. So you have to be very specific. I want you to sit. We will do the jumping activity after 5 questions or after 2 questions. Again, it should be age appropriate. So this prepares the child that I am going to get a space, I am going to get a time for my hyperactive behavior, and then we can proceed further. Okay. Rewarding good behaviors. जहाँ पे बच्चा अच्छे से बैठ रहा है, even for 1 minute, even for 2 minutes, the child is listening to you. Praise that child. I'm very happy. I'm so happy that you are paying attention. You're doing your work so nicely. You are listening to me. So give me a high five. Take a step. Or for this, you can also prepare a reward chart for the child, which is placed on the wall. Again, when the child, like for an example, XYZ child is coming, तो XYZ child का ही chart आपने wall पे लगाया है. If another ABC child is coming, तो सिर्फ ABC का ही child उसके सामने, chart उसके सामने है. Okay, so rewarding good behaviors, good attitudes, good the person, the child, how the child is responding to you, whatever good behavior is she is showing it to you. Giving them a break. If you want, if you're keeping a target that I want the child to learn 5 answers, तो अपने पूरे सेशन को डिवाइड कर लीजिए. सबसे पहले आपने एक फिजिकल ब्रेक कराया, फिर एक आंसर लर्न कराया, फिर दोबारा से कोई ब्रेक दिया. इट कैन बी अ सेंसरी ब्रेक, इट कैन बी अ मूवमेंट ब्रेक, इट कैन बी एनी रिलैक्सेशन एक्टिविटी. फिर दोबारा से एक आंसर लर्न कराया या 2 आंसर्स लर्न कराया अकॉर्डिंग टू यू, according to the level of the child, and then giving a 2 minutes break. Then again you are focusing on making the child learn the answer. So this how understanding the short term goals that you are keeping and how you're objecting keeping the objectives of your particular session. So dividing the session task, session objectives into small activities and giving breaks in between. Using tools and flexible rules. Like for an instance, if the child is not at all ready to write, so changing the tools of writing. You have to be flexible. We will say, okay, fine, we will not write, we will draw. आपका मेन पर्पस क्या होगा कि बच्चा उस कंसेप्ट को समझे, राइट? या उस बच्चा द चाइल्ड शुड बी एबल टू लर्न द आंसर. So we can change the writing tools. Instead of saying the child to write, okay, let's draw, and you speak out the answers, I will write it for you. Okay, so you have to be little flexible, creative with the tools and the rules that you are using. If the child is resistant and not understanding, not listening to you, not ready to use a pencil, to use a pen, change the tools. Similarly, for reading books, if the child does not want to read a book, give him some of the flashcards to read, give him some of the picture cards to read. Okay, fine, we will just read this particular picture. Okay, don't overload them. Overload in the basic sense means like if you're carrying a worksheet having 20-50 questions, जैसे ही आप वो वर्कशीट टेबल पे रखेंगे बच्चा डर जाएगा. Oh my God, there is so much, so many questions to do. ठीक है? So what I used to do is मैं खाली एक दो फ्लैश कार्ड बनाती हूँ जिसमें मैंने सिर्फ 2 क्वेश्चन या 1 क्वेश्चन लिखे होते हैं. ठीक है? Now I'm having several flashcards. Like for an example, वो 20 questions को ही मैंने 10 flashcards में convert कर दिया. On one flashcard, there is only one question or two questions. But at the time when the child is seated on the seat, the child is able to see only one or two question on the flashcard. It is very easy for the child. Look, only two questions I have to do. That's great. I will be able to do it. So don't give them a sense that yes, today we are going to do so much of academic task. You have to give me that particular attention. आज हम इतना सारा काम करने वाले हैं. जैसे ही बच्चे को ये फीलिंग आती है कि इतना सारा काम होने वाला है, वहीं पे the child will start showing his hyperactivity. Okay. Then encouraging support, breaking task into small steps, very important. Next, now supporting hyperactive child in teaching again, creating a structured environment, बहुत clear rules, routine होने चाहिए, एक organized set pattern का होना चाहिए. Like for an example, आप हमेशा 5 बजे ही session लेते हैं, so very important to inform the child also about that time. एंड एवरी डे जो भी लाइक मंडे ट्यूसडे वेडनेसडे आप ले रहे हैं तो मंडे ट्यूसडे वेडनेसडे 5 बजे ही होने चाहिए. It establish the clear routines and rules and also give the sense of organization to the child. Using visual aids आप बच्चे को यूज कर रहे हैं कि आज हम ये एक्टिविटी का मंडे को ये करेंगे, ट्यूसडे को ये करेंगे, वेडनेसडे को ये करेंगे, with the help of some clip arts, with the help of some gifs, pictures. Okay. Designate specific work area, that this is your seat, this is your space area, this is your working area, it's your room, it's your table, it's your wish how you have to decorate it. So giving that sense of, that this is mine, this is my space in which I can do anything, I can draw, I can play, I can color, I can talk, I can read, I can learn, gives that sense of accomplishment to the child, that I have earned something of my own. Okay. Break down the task, dividing the task into smaller manageable steps, providing clear and concise instruction, giving breaks, which we have discussed. Now, breaks can be sensory breaks also, like squeezing a ball, stressing a ball, kicking a ball, or jumping, or walk on the sensory path. Okay. Positive reinforcements, minimize distraction, effective communication, organized environment, very important. Organized, अगर बच्चे के रूम में ही, क्लासरूम में ही, या जहाँ पे आप सेशन ले रहे हैं वो सारा आसपास का उसका बिखरा हुआ है, the pages are lying here and there, the files are kept over and there, the child might feel angry, the child might feel frustrated, might not pay attention to it. Okay. इंस्ट्रक्शनल स्ट्रैटेजीज, जब आप बच्चे को कुछ समझा रहे हैं, कुछ इंस्ट्रक्शंस दे रहे हैं, तो उसके लिए आपको क्या करना है? मल्टी सेंसरी लर्निंग, engage the multiple senses of the child, auditory, visual, kinesthetic. अभी हमने lobes के बारे में पढ़ा था, brain lobes के बारे में. तो some of the other, like we have discussed that this particular brain is having लेस लेवल ऑफ एक्टिविटी. तो अगर आप बच्चे के दूसरे लोब्स को या दूसरे सेंसेस को भी यूज करेंगे तो उनके बच्चे के बाकी लोब्स जो हैं ब्रेन के वो एक्टिव हो सकते हैं, जिससे बच्चा सीखेगा. ओके. That is the reason we say that use multi-sensory learning, that if particular one function of the lobe is not working properly or not having that kind of processing level, the other lobes can perform their functions. So multisensory learning helps a lot. Visual supports like using graphic organizer diagrams. Short and focused lessons. छोटे से goals बनाइए, छोटे से objectives रखिए अपने lesson के. Opportunities for movement. Hyperactive child के लिए जितने ज़्यादा movements रखेंगे, movements के through पढ़ाएंगे बच्चे को, बच्चा और अच्छे से सीखेगा. Collaborative learning, group activity, छोटे से group activity करा दी, and the members in the group are also can be according to the interest of the child, or it can be according to whatever the other student should be able to understand his or her hyperactivity. Okay. Additional trick for parents, for educators. Now, involving parents. अगर आप कोई भी डिसीजन ले रहे हैं, आप पेरेंट्स को भी इन्वॉल्व करिए, उनसे रेगुलरली कम्युनिकेट करिए. Encourage parents to use your strategies at home also, or you can also provide them with home intervention plan कि आप अपने घर को कैसे arrange करें so that it helps the child with ADHD or hyperactivity. Seeking professional support. Encourage the parents to meet a special educator, counselor, psychologist. Consider accommodation modification. Accommodation modification ki I will discuss it in my another video in detail, not to worry. Patience and understanding. To be very patient and understanding is a very important. You can say value or you can say the quality of a special educator and also of a parent. बच्चे की strengths, challenges, weaknesses को समझने में time लगता है. And it is very important that we need to be patient. Every time have an observation chart with you. जब भी आप session ले रहे हैं, अपने पास एक observation chart जरूर रखिए जिसमें column strengths का हो, challenges का हो, weaknesses का हो, and keep on noting down whatever the child is saying, whatever the child is doing. उसी में ही आपको उसके strengths और weaknesses पता चलेंगे. Remember, every child is unique, and what works for one may not work for another. It's essential to observe and adapt our strategies accordingly. Consistency and patience are key to helping a child with hyperactivity succeed. Next, now, how to support a child. Okay, this is the case study. Actually, it's mentioning about again the same of the techniques that I mentioned in the previous slides. And it is also showing the same characteristics that we have discussed. So you can, I will share this with you. You can go through it. How to support a child in learning, giving them structure. अगर आपको कोई चीज बच्चे को याद करानी है, याद लर्निंग करानी है, मेमोराइज करानी है, मेक श्योर जहाँ पे बच्चे के पास जो भी आंसर्स हैं वो शॉर्ट होने चाहिए, विजुअल एड्स होने चाहिए, वीडियो होनी चाहिए. आंसर्स को आप थोड़े से उसमें क्लिप आर्ट्स डाल सकते हैं, छोटी सी इमेजेस डाल सकते हैं, सो दैट बच्चा उसको अच्छे से मेमोराइज करे. कुछ कीवर्ड्स याद करा सकते हैं ताकि वो कीवर्ड से खुद ही अपने आप खुद अपने आंसर्स बना सके. बुलेट पॉइंट्स में आंसर्स को लर्न कराइए सो दैट द चाइल्ड फील इंकरेज्ड दैट आई डोंट हैव टू लर्न लॉन्ग पैराग्राफ्स. हैंड्स ऑन एक्टिविटीज के थ्रू बच्चे को याद करा सकते हैं. माइंडफुलनेस एक्टिविटी, रिलैक्सेशन एक्टिविटीज इन अ वेरी फन वे. अगर आप इंकरेज करेंगे तो बच्चे की मेमोराइजेशन स्किल्स, रिटेनिंग पावर भी इनहांस होगी. क्लियर एंड कंसाइज इंस्ट्रक्शंस और आंसर्स देकर बहुत सिंपल आंसर, लाइक अगर कोई इफ देयर इज अ लॉन्ग आंसर व्हिच हैज हैविंग वेरी कॉम्प्लेक्स वर्ड्स, तो उस आंसर को जितना हो सके ब्रेक करिए, उसमें सिंपल वर्ड्स डालिए अकॉर्डिंग टू द लेवल, अकॉर्डिंग टू द लर्निंग कैपेबिलिटीज ऑफ द चाइल्ड, एंड देन encourage द चाइल्ड टू लर्न इट. ओके, और लर्न कैसे करते हैं वो भी आप बच्चे को सिखाइए कि बाबा रिपीट करके आप बोल बोल के लर्न करिए, इसको बार बार लिखिए, आप अच्छे से लिख कर आप याद कर सकते हैं. गेम्स के थ्रू आप बच्चे को याद करा सकते हैं. डायग्राम्स के थ्रू कि आप बच्चा उसका डायग्राम बना सकता है, ग्राफिक ऑर्गेनाइजर बना सकता है, एक टेबल बना सकता है अगर डिफरेंसेस को याद करना है. सो टेल देम द वेज मेथड्स ऑफ हाउ टू लर्न. Revision, regular revision of that particular answer on a regular basis will also help in retaining the information or the answer. Teaching the child self-regulation strategies. अगर आप एक आंसर लिख रहे हैं, प्रेजेंट कर रहे हैं आंसर को, या अपने किसी वर्क को प्रेजेंट कर रहे हैं, तो उसको किस फॉर्मेट में दिखाना है, दैट ऑल्सो नीड टू बी टेल. सेल्फ रेगुलेशन स्ट्रैटेजीज में अपने इमोशंस को समझना, अपने इमोशंस को मैनेज करना, दैट इज ऑल्सो वेरी necessary. So, how to identify your emotions? By talking to yourself, by listening to your inner voice. And इसकी भी कुछ activities होती हैं, worksheets होती हैं, which you can easily find it on Pinterest, on Google. So, encouraging the child that how you're feeling. मैम ने आपको डांटा, मैम ने आपको allow नहीं करा, so आपको कैसा लग रहा है अभी? How you're feeling? And what should we do? आप कैसे बिहेव करेंगे नेक्स्ट टाइम, या आप क्या करेंगे कि मैम आपको एक्टिविटी में अलाउ करें या आपको पार्टिसिपेशन की अपॉर्चुनिटी मिले. सो हैविंग दैट कन्वर्सेशन एंड शेयरिंग योर स्टोरी ऑल्सो, दैट समटाइम्स इफ व्हेन आई रिमेंबर my mother or my teacher used to scold me, I also used to feel sad. Then I used to talk to my teacher and understand ki ma'am, what was my mistake, so that you did allowed me to participate in this activity. So encouraging the child to identify emotions, managing emotions through conversation, through communication, or even some social stories will be very beneficial. Okay, so that's it for today. Thank you, everyone. Have a wonderful day. This is my channel, Tanabatra Learning Support Educator, and I request you all to subscribe to my channel. Any doubts, anybody?